Welcome to Hand Therapy Briefs. My name is Marella Deischer. I'm the founder of Virtual Hand to Shoulder Fellowship. And today I'm excited to have Mary Dougherty, who has worked on missions trips that I'd like her to discuss and share what her experiences were like. Because I think this is something that for therapists that are interested in giving back to the community, there's different opportunities, and this is just one of them. So Mary, can you share a little bit about what this missions trip is?
Sure. Well, first of all, thanks for having me. I'm excited to
Sure.
be here. Um, and so I've been a therapist for over 30 years, and really only working in hands for most of that time. And one of my mentors, um, actually two of my mentors, were going on these mission trips as surgeons for 20 years. And, they would often say, like, you should come sometime. And so, anyway, I mean, that was always in the back of my mind. And their pictures were always amazing. And their energy and passion for serving the underprivileged was really contagious. So, that's how I first started to hear about it. And in our field, um, as hand therapists, especially, a lot of times you really get to work very, very closely with the doctors. And I did have a chance to work side by side with two of these doctors who were doing these mission trips. So I kind of knew that I would always end up getting there at some point as soon as my life allowed. And so after my son was raised and out of the house, I told both of them, like, I'm ready. And so that's how it all began. And this past 2024, I actually went on two mission trips. And the first one was to Honduras with a group of surgeons and therapists, and the surgeons bring residents, and the surgeons bring their fellows, and they bring um, surgical techs, and they bring all their equipment. I mean, all their equipment. We and then they bring their therapists, and we bring all of our equipment. So that was the first trip in January, and then this second trip in April, I went with this specific group, which is called Guatemala Healing Hand Foundation. And I mean, both trips are great, and both services are great. But Guatemala Healing Hand Foundation is very special because Lynn Bassetti, I think you've spoken with her before.
Yes. Mhm.
She's such a dynamo, but she's just a regular OT CHT who had this vision to serve her country. And boy, has Guatemala Healing Hands like exploded into the most
Right.
unbelievable foundation. So it was through one of the physicians that has been going on that trip since the beginning that I was invited. And
Okay.
that's you either get invited, or you like find these foundations and you are persistent, sometimes for 5, 10 years, till they have a space for you. It,
Wow.
yes, Lynn told me that,
Okay.
it's really,
So there's a waiting list.
oh, there's not a ton of opportunities. Like, if you want to go as a CHT, like, you could
Okay.
probably find other opportunities and not be functioning as a CHT. Like, you could be a volunteer.
Right.
You need a lot of them. The Spanish speaking is a huge deal, and just
Right.
simply being organized, that we have a lot of non-medical volunteers also.
Okay. Does the Honduras trip have a particular name? Like there's Guatemala Healing Hands, but if someone were searching for the missions trip to Honduras, how would they find that?
I'm gonna have to get back to you on that.
Okay.
Yeah.
Okay, so we'll come back to that. So can I advance through some of these images and maybe you can talk to us about what we're seeing?
Yes. In teaching me so much, and and bringing me on the Honduras trip. And as you can see, he passed this year. So I'm carrying on his altruistic spirit of giving and kind of trying to honor him a little bit for being such a great teacher to me and sharing his skill with so many. That's our donate page because Guatemala Healing Hands is not well funded. The Honduras trip was well funded. They had some very, very big benefactors. Guatemala Healing Hands is different, and they have to work really hard every year to try to fundraise enough money to
Okay.
pay for the surgeries. And we all pay our own way. Like, Honduras, I didn't have to pay for my trip. This I have
Oh, wow.
to pay for my own trip. I have to use my own, vacation time. So we really appreciate every donation.
Okay, so I'm going to put this in the notes for this video for anyone that wants to donate.
That'd be great. And the other doctor is Dr. Talsania, and he's right in Allentown and has been a great, great teacher to me, and invited me to go to Guatemala Healing Hands. This is like his 21st trip coming up this year. We're going in November.
Want to answer this?
The following slides will. So
Okay.
so here we are. Hospital Escuela. Broken windows. I don't know if you could see that on the right.
Wow.
Keep
So
going.
this is a public hospital.
Yes. This is the surgery suite, and it's
Wow. Is this their, like, the medical doctors' lockers?
oh, we don't have them, but it's their staff. Yes. Yes. No, nothing OSHA there.
Yeah.
Yeah.
What are you doing, Kara?
Like it's like moving from one part of the hospital to another. Uh-huh.
You're climbing up the ladder to go to a different section of the hospital? Wait, can you explain that?
It just seemed it's not like a well laid out place, and that's the quickest way for people to go, and it's very unsafe. And we don't usually do it, but they always take the newbies to so you can see what it's like in the life of like a real employee there.
And what's on the other side of that wall?
A roof that leads to the surgery suite.
Oh my goodness.
Uh-huh. Look at
Okay.
old equipment, and look at the cribs.
Yeah, wow. And yeah.
Who knows what that old bottle of bleach that's hanging off the crib is collecting? I don't even know. Again, equipment that is older than me possibly, and just lining the halls. Look at the ceiling in the surgery suite.
Oh my goodness, wow.
And why am I holding toilet paper? Because
Yeah, what?
toilets there, they don't have seats, number one. It's just the toilet. You know how we have a seat? There's no seats, and there's no toilet paper. Like,
Oh.
the families actually bring the patients their food and clothes. They don't provide gowns. They don't provide like 3 meals.
Mhm.
So you have to bring your own. BYO. Toilet.
All right, so toilet paper is a hot commodity, it seems like.
This is the beautiful military hospital, and they, it's very political, and the government wanted to show like how much they're supporting the American doctors coming there, so they had a big press conference. Now we're in Guatemala, and this is the mission hospital, and it's really lovely. As you can see, the colors are great for the kids. the Moore Center, you know, they made us cookies with joints on them. It was really sweet. So I thought I could tell you a little bit about some of the things we see when we're there. It's a lot of congenital stuff, lots of congenital stuff. But there's a lot of injuries also, that we might not see there,
Mhm.
that we might not see here, like machetes and domestic violence also. Um, so hundreds and hundreds of people come hoping for a surgery. And, you know, if we were here in the United States, it'd get a little angry sometimes, right? People are tired and they're waiting, and but not in Honduras and not in Guatemala. They are the most grateful people. They have traveled so far from their home villages, and they are patient and kind, even when they get turned away. So if you want to go on a medical mission trip, be prepared to just be organized. You got to get dirty. You got to sweat a lot. This is us over these next few videos, slides. We're just setting up our space, you know, empty rooms. And then we have a room for the doctors. We got a room for the intake. We've got a room to take pictures. We got to set up our therapy room. And Lynn Bassetti has this down to a science.
Mhm.
They really use the OT team to help orchestrate and organize all of this. They use our organizational skills, but they use our medical knowledge. We're the first person they see. We do the initial assessment.
Mhm.
Here's our little OT station for um, at the Moore Center.
So if you're doing the initial assessment, are you just, I guess you're using paper documentation, handing over your paper assessment to the docs?
That's right.
And how many patients are you seeing, like in a day? Like how many of these assessments are you doing?
Well, I mean, usually there's like um, 90 to 150 people that get screened
So what time would you start in the morning?
very early, you know, first thing in the morning.
And then, so what time are you done?
Whenever we're done, we stay till the end. So it's late. That's a very late day. So very early in the morning. I mean, we're probably getting there no later than 7.
Hmm.
And I mean, I don't think we're out of there till 6. Like that's a long day.
Yeah. And this is over the course of how many days are you doing this?
So when we arrive on Thursday afternoon, we just get settled to the hotel. But Friday, that's Thursday. Friday, we try to get to the Moore Center after the last mission has left and after they've had some time to clean, because we need to get set up, because
Hmm.
Sunday is screening day. Saturday's a different day. I can tell you about that another time, but Sunday is screening day. And then
Okay.
Monday through Thursday and Friday morning are surgery days.
So the screening day, meaning you are one of the people doing the screenings along with, like everyone is doing screenings.
Yeah, so we do the intake, and then we stay with them and take them in for their physical exam with the doctor, and that's where they decide if they're going to be able to do a surgery.
Hmm.
And they look to us, you know, just to give a quick history, because lots of these are repeaters, you know, they're staged surgeries. They can only do so much at one time, and
Yeah.
a lot of them have to have multiple surgeries. So, you know, after we've done that intake, we present the case to the doctors, and then they work with the family and the patient to decide if they can do enough good this time around to do a surgery. And if they
I'm so, oh,
then
sorry.
and if they do decide to do it, I mean, they're taking x-rays, they're doing a whole maze of scheduling, and you
Mhm.
know, and then from there we take them possibly to their next, to anesthesia, to social work. If they need a splint, they go to therapy.
And what about the language? Like, how's that navigated? Is there a translator with each therapist? How's that work?
Hard. It's hard. There's not a translator with each therapist.
Oh,
So I don't speak Spanish, and so fortunately, some of our therapists do. And so Lynn does the intake, and she's able to communicate with them in Spanish. The second stop is for them to get pictures of what is being done, and that's where a lot of the volunteers are, and there's Spanish speaking volunteers in there.
hmm.
And some of the physicians are Spanish speaking. So when we get into the physician room, there's an interpreter in there. And if there isn't, then I'm looking for one of those high school or college students that came on the trip that speaks Spanish to come with me.
Okay.
So just in case your students want to, look at this, that's just a nice verbal explanation for some of the pictures we're going to be seeing now. That's a one arm elbow on the left. That's the first time I heard that saying, and saw two of them. And it's just a fusion at the proximal aspect of the radius and the ulna. And so those children have compensated. And so all their supination and pronation is at the wrist. It's unbelievable.
Interesting.
Yeah.
Wow.
And so I learned, that was a great thing that I learned. And then these are just some pictures. On the right, that's somebody who already had a surgery.
This patient did.
Yes, but they'll try to do more for this patient.
What did they do? Did they separate the digits?
Yeah. Yep. And you can just go. I'll stop if there's stuff to say. The doctors they just work so hard. This is one of my favorite cases. So 13-year-old, he was 11 when he first fell. He did get it fixed. He got it pinned and it healed pretty well. But he fell within a year again, and he re-broke his forearm. So he was 11 when the first one happened, then he's 13, and his parents weren't able to get it fixed. So now he's 15, and this is what he presents with. So keep going and take a look at that X-ray.
Oh my goodness.
So he was really one of my favorite cases because there is a picture at the end of that fixed. It's a really nice, clear picture of what these syndactyly and brachydactylies look like. Polydactylies. Lots of duplicate thumbs. Lots of club. But that's a really simple, clear picture of what an easy one looks like, right? But boy, there's a lot that goes into, now that's a much more complicated surgery.
Yeah, because here there's more bony type fusions.
Yes. But what's funny, if you go back one, as simple as that one looks, boy, was I really schooled to hear the doctors talk about why they had to cut which piece off because of the stability of each joint. Like, there's still a lot to even the simple ones.
So it was either taking this or this, right?
Yes.
So which did they take?
For that one, I think they took the one closest to the pointer finger.
Interesting.
But I can't even be sure about that.
Now, is this hand,
yes.
this X-ray?
Yeah.
Yeah.
Imagine. That's Sharon. She's been going on the trip forever. She comes, she's a PT and she comes from Fairfield, Connecticut. The organization to schedule the patients, because we saw a lot of patients pre and post-op. And we did therapy sessions for the patients who did not get surgery. We made braces for them. We showed their parents programs. but so much organization to get everything to run smoothly. Go back
Quick
to
question though, quick question,
that.
because you guys were there for how many days?
Like Thursday to Saturday.
So if they're getting surgery, who's doing the taking down the dressings and the post-op
Oh,
management?
wow, that's a great question. So one of the purposes of these mission trips is to train the Guatemalan and the Honduran therapists and doctors.
Mhm.
So, you know, the most complicated cases get done on Monday and Tuesday so that the doctors and therapy can follow up in the days to come. But once we leave, um, it's they have a doctor from Guatemala who's with them, who they're, he's taking notes on what happens when, and then they have virtual phone calls with that doctor during some of the post-ops.
Mhm.
And then we get to have some time with the therapists. In Honduras, the therapist wasn't able to get away, and we only got to literally meet up with her for an hour and give her the supplies we brought her, the donated supplies. But
Mhm.
in Guatemala, we, you know, there were days that I stayed at the hotel and the local therapists came with their patients to consult. So we,
Oh, wow.
yes, so we met so many of the Guatemalan hand therapists,
Mhm.
and we helped them problem solve with their patients and taught them some splints. Sometimes we just do in services on, current trends in flexor tendons or extensor tendons or whatever.
Right, that's amazing.
Mhm. We did get a lot of time in the operating room. Um, so I learned so much from being in the operating room. It's just a whole new learning experience, and so I did get to have plenty of time. Um, Tiny little corner room at the hospital,
Mhm.
for my splinting pan, because some of the doctors like you to splint before the patient wakes up, and I actually am a big fan of that. Um,
Yeah.
and then on the right, as you can see, I had a volunteer with me, and I thought these people are going to lose their papers with their protocols on, so we wrote it right on the splint.
Mhm.
The lack of tools, I mean, all we have is what we bring. They don't provide us, oh, stay there for a minute. They don't provide us with the tools. Like the doctors have to bring their own stuff. So that previous slide, there was a patient there who had, I think, proximal phalanx fractures that had been plated. Well, now, they're healed, but he has no motion. And so they're taking out every single plate without screws, without a screwdriver.
Oh my God.
Yes. So they literally took, like, talk about, that's the other thing. You think you might be good for this? Make
Mhm.
sure you can think out of the box. And I'll tell you why. They took their scissors, their clamp scissors,
Mhm.
and a blade. The blades they use to cut open,
Yeah.
and they undid whatever, 3, 6, no, 12 screws. It took
Wow.
forever. It took forever. And they're also letting the students and the Guatemalan people do this so that they can learn. So
Mhm.
I'm used to the doctors here doing 8, 12 cases in 5 to 6 hours. In this case, we're in the operating room for 8, 9, 10 hours, and we're only getting like 5 cases done. And in the beginning, I was like, why aren't we getting more done? And it's because you have to let these people learn. We need them to be independent. Give a man a fish, feed him for the day, and
Mhm.
teach a man to fish and feed him for a lifetime, right?
Mhm.
So this is Ariana. She was one
Mhm.
of my favorites. So we did see a lot of these are brachial plexus injuries from birth. And so this is Ariana. And so we had to put her in an airplane splint after because she was subluxed, she was
Mhm.
out, and
Mhm.
her brachial plexus was stretched. So that was a great learning experience from me. I fed that baby girl almost a whole bag of Hershey Kisses in order to get that done. Unbelievable things that we got to do and to see. That's Lauren and I. Just four people, two therapists together all the time because you need four hands.
Yeah. Oops.
Um, Dr. Culp always used to initial his drawings, and so that was him explaining one of his the way he ties his flexor tendons, and that those are his initials at the top. And when I found that after he just recently passed, I was like, oh, that's like a treasure for me.
Yeah.
And then what's this picture? Oh, this is a great one. This is oh, so you know what a hunter rod is, right?
Mhm.
No hunter rods. No hunter rods. And this person needed 4 hunter rods. So what do? You take a sterile catheter out of the bag and you make it into a hunter rod. Like
Mhm.
unbelievable the things that you have to improvise on.
So again, and then the second procedure is done by.
Oh, they probably will wait until we get back next year.
Oh, wow.
I know. I know. Just examples of yeah.
Home programs translated.
Yeah. And see the pictures we take?
Oh, uh-huh.
Yeah. This is a great example of the paperwork we do.
Okay.
You know,
Like the old days, back to
just
paper.
like the old days.
Yeah.
There's not a. This is when the therapist came to the hotel. This is conference room, and there were like 5 or 6 therapists, and there were about 3 patients, and we just looked at what the problems were and told them how we treat it, and if they wanted to proceed with following that, then they did. And these are
So how many therapists are on a trip like this?
Um, so for Guatemala, usually about 6.
Okay, and they're all US therapists, or does that
Yeah,
include they're
yeah.
US therapists? Okay.
This is my favorite one that I was telling you about, the teenager with the
Oh, right.
yeah. And so what's interesting is that when they fixed that radius,
Uh-huh.
they couldn't get rotation. They could not get rotation. They had to go and do an osteotomy on the ulna in order to get full rotation. So there he is.
And mechanically, just curious, why? Like, what was the mechanical reason?
Oh, because it had bowed uh, from from the malformation of the radius.
Oh, the ulna adaptively bowed.
Yes,
Gotcha. That's really interesting.
fascinating, right? So there's another link, that previous one, and then yeah, that's another link to Guatemala Healing Hands. Um, that's like the page you go to read more about Guatemala Healing Hands.
Hmm.
But as you probably know, this particular mission trip has like really expanded, and it's more than just the surgery. And they've adopted this village and they have
Yeah.
done so much. And we had somebody come on our trip this year who she knows the Bassetti family really well, and she decided to donate. And if you want to donate, I think when she did it, it was $3,400. Then
Mhm.
you can actually buy a home. That's what it costs for a family to get a home. And so you're going to see in a minute this gal who donated. You're going to see her meet the family that got the house. We distribute food. Okay, so here she is. She's hugging the family. This is the
Mhm.
family that is standing by their house, their new house, and it's a one room house. It is a one room house, and there's like 6 or 8 people who sleep in it, and they could not be any happier or more grateful. It's pretty much like a cinder block home.
Yeah.
And I don't want you to think we didn't eke in a tiny bit of fun here and there, because we did.
Mhm. And again, this was 6 days?
Mm, this was, I think this was 10 days.
10 days. Okay, you guys really get a lot packed into this one trip. We did have Lynn. I interviewed Lynn about Guatemala Healing Hands, so she talked about all of these components, not just, the hand surgery piece, but like going into the communities. And it amazed me how
Huh?
much got done in one trip. It's
Can't
really
believe.
amazing.
Yeah, this is like the market. We would only have like a couple hours here, a couple hours there, but they really try to take the newbies to get the whole full experience. That's Lynn and her daughter Mona and her son. I can't think of his name right now, but her whole family's involved.
Beautiful. So what would you say to someone that, is thinking about doing something like this? I know you said that there's a waiting list.
Yeah,
But
I mean,
in turn, go ahead.
if this is something you want to do, um, you need to find a trip. Find a trip and stay in touch with that organization until they invite you. And it could take
Mhm.
you years. But
Mhm.
if you want to go as just a lay volunteer, that's one thing. If you want to go to as a CHT, um, they're very willing to help you and mentor you, but they're definitely looking for therapists who, like, if you're left alone with another therapist, like the two of you have to be able to be very independent in knowing how to make the splint. You don't have a lot of time. So you
Yeah.
do have to have a certain skill level. And I've done this for so long and have had to work in fast paces where you're churning out splint after splint after splint. So I was comfortable doing that. But
Mm.
you know, um, you have to be confident in yourself
Right.
as a therapist, like, to contribute to the team. Um,
Mhm.
and it was a little, it was a little nerve wracking. But everybody there they're so happy you're there and they want you to succeed. I would like to mention the Vargas Award.
Okay.
So there's a lot of Vargas Award members, uh, therapists that go on this trip. And basically, ASHT has this award. And this is how Lynn started this. They choose somebody who applies for this award. They choose somebody, I think, every year. And I have to be honest, even as a CHT, I didn't know a lot about it. And I think there were 4 or 5, maybe at least 5 Vargas Award winners on the trip.
Mhm.
They basically give you money. Let's just say
Mhm.
it's $10,000, but I don't really know how much it is. And they're like, find a trip and use this money to go on the trip, to donate the trip to the trip, and then spread our knowledge and share it. So
Okay, great. Well, I'll put links to Guatemala Healing Hands. I'll also include the Vargas Award application, maybe. Just
yeah.
and then for Honduras, is there a pathway for them to?
Oh yes.
And you can send that to me and maybe I can add it just to the comments for anyone that's interested.
That's what
And
I'll do.
there are also other missions trips that go to different countries. So, if this is something that really resonates for you, you want to contribute in this way, there are definitely opportunities out there. These are two great ones. So thank you so much, Mary, for sharing your experience. It's really nice to hear about it from your perspective. You went there, and to get your perspective is really insightful. So,
Thanks. I'm really excited to have the opportunity to share.
well, thank you. And I thank everyone for joining us today.
Make sure my info's there if anybody wants to reach out to talk to me about it.
Okay, so I'll also add Mary's email so you can reach out to her also. And again, thanks for watching. Hope to see you again soon.